Kick-ass facts! Pew, 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 pew! What's my latest rabbit hole? Outdated medical terms. I'm sure it has nothing to do with the fact that I just got 2 letters from the Canadian government saying you're over 50. It's time to get your boobs and your ass checked. Lumbago. I just heard this one for the first time while watching the Hudsucker Proxy. And it means generalized lower back pain, often related to muscle strain, herniated discs, or arthritis. It comes from the Latin word lumbus, meaning loin or lower back, and the suffix ago was often used in medical Latin to describe a condition or ailment. There go. Lumbago literally translates to pain in the loins or pain in the lower back. We stopped using it because it was too vague. Now we have things like lumbar strain or sciatica, or in my case, degenerative disc disease. Apoplexy, a sudden, severe neurological event, typically a stroke, caused by either a blood clot, ischemic, or bleeding, hemorrhagic in the brain, originating from the Greek word apoplexia, meaning a striking down or sudden shock. It combines apo, away from, and plesso, to strike, reflecting the abrupt and dramatic onset of the condition, which was typically categorized by a sudden loss of consciousness, paralysis, or death. It stopped being used because it also didn't distinguish between different types of strokes or other types of neurological changes. Dropsy, swelling caused by fluid retention in the body, often due to heart failure, kidney disease, or liver problems, edema. Dropsy was a non-specific term, while modern medicine now identifies and treats the underlying cause of swelling, leading to a more accurate diagnosis. Edema replaced this term, as it is more medically precise. The term dropsy comes from the Greek word hydrops, which means water or watery accumulation, and was later shortened in Old English to dropsy before becoming dropsy. Consumption, which we now call tuberculosis, is a bacterial infection that primarily affects the lungs and can spread to other organs. It was called consumption because it described the wasting away of the body seen in advanced tuberculosis, giving the impression that the disease was eating away at the person from the inside. It did not reflect the infectious cause. By the 19th century, it was discovered that tuberculosis was caused by a bacteria. This shifted the focus of the disease visible effects wasting away to its underlying cause, leading to the adoption of the term tuberculosis. The Vapors. We need to bring this one back. It was not just an English new wave band from 1978 to 1981 who had a hit with the song Turning Japanese. It was also used historically to describe fainting spells, dizziness, or weakness, often attributed to women and thought to be related to anxiety or stress. It was also based on the outdated and superstitious beliefs like the imbalance of humors. Modern diagnosis has now called it what it is, generalized anxiety disorder, or other terms that more accurately describe the condition. This is why I think we should bring it back. It is also going to bring back an old-timey piece of furniture called the fainting couch. Whenever someone says something dramatic, you just go, "Oh, the vapors!" And then you pass out on your fainting couch. Bright's disease, named after Richard Bright, a British physician who is credited with identifying and describing a group of kidney disorders in the 19th century, the term Bright's disease became a catch-all for all various kidney-related conditions. Modern advancements in nephrology brought us to more specific diagnoses like glomerulonephritis, this fucking thing, or nephrotic syndrome, and are now used to describe specific kidney conditions.